Good morning everyone. I am Dr. Thiru, specialist in ENT working in KIMS Bahrain Medical Center, Moharak. Today I am going to talk about the various health conditions that could possibly come during winter season. As you can know that during winter season a lot of people catch cold. So which is a very common and important condition that happens in each and everyone's house, which involves more of children basically, though even adults are being involved. So we need to just identify what type of infections actually occur in these things. Two major entities are there. One is this is the normal viral cold. The other one is allergic symptoms. So basically cold is the etiological factor is viral, which may you'll see for like which may come to around 3 to 4 days a week, and which will actually you will have stuffiness of the nose, you will have watery secretions, nasal secretions, you might have cough, throat irritation and things like that, along with fever, headache and lethargy, in the sense generalized weakness will be there. This can be very much commonly seen in children, at least those who are going to the schools. And when school children, one can usually identify that there will be like a lot of other children also there affected with cold, and usually they will have high temperature also, as I mentioned before. So allergies are like, they are like nothing but body's overreactive immune system to the surrounding things that we find in our environment. So allergies comes like it will have itching of the eyes, itching of the mouth, oral mucosa, hard palate and throat and all. And there here you will have more of excessive sneezing, bilateral nose gets obstructed, and you might even have headache again. This also can cause headache. So headache can be again due to nasal allergies, or there is various other factors such as migraine headache, headache due to tension, hypertension, excessive. And as I said, in the cold you will have like thin and clear mucus secretions will be there. The running nose will be more of watery in nature, and which might get thicker as days goes by, because initially it will be viral and then it can become bacterial infection, and of course it needs to be attended with medical assistance at the earliest. And if one child gets cold, it is very easy for the other children of the school to get it spread in their class itself. So whereas the treatment are concerned, we usually give some decongestants, we say, because it will reduce the congestion of the sinuses and nasal cavity, and we give steroids, which are like least side effective, and it has to be used for a few months together. But there are home remedies that you can do when you identify your child or your colleague or spouse is having cold symptoms. You should make sure that the house is dust free, make your environment very clean, and not to be exposed to fans or air conditioned air for long nights. You can reduce the temperature of you can maintain the temperature of the air condition in a pretty normal way, like 24 to 25 degrees centigrade, and try to use least number of carpets in the house, so that the dust will be less accumulated in the house, and even people who have pets in their house will have a lot of cold symptoms coming, like allergies. And then basically you have to you have to avoid cold food stuff, ice creams, juices, taking them especially at late night, which can actually aggravate the cold factors. So whether it is cold or allergy, we have the remedies for that. So you should surely come to the hospital, take the assistance of the doctors, and the early the treatment you take, the early you will feel better. Wish you good luck. Thank you.